I was telling myself. Hello, I'm Joshua Perkins. I'm with Compression Care, and I'm welcoming you to our fourth Spotlight Educational Series of 2025. Watch your schedules, watch our schedules on our website, or watch for my emails, and you'll see the future presentations that are coming up. And before we get into Karen's presentation, which is going to be wonderful today, I want to tell you a little bit about Compression Care and our sister company, Pretty in Pink Boutique, which is based in Nashville, Tennessee. We've been in the business of helping patients with their compression needs and billing for garments for 20 years. April is actually our 20-year anniversary. So Compression Care is a national vision of owner and founder Pamela Ludwig. Pam started PIPB and Compression Care with the goal of helping patients get the care they need while never paying more than they have to. And at Compression Care, we strive to improve patients' lives by making high-quality care accessible, affordable, and convenient no matter where they live. A new development that just happened is we launched our therapist portal. So if you are sending referrals to us, you can now log in and see the status of all of the patients that you have sent to us. So you'll know exactly what's going on, and a future update coming, hopefully in the next week or so, we'll be able to have the tracking numbers in there as well. So you can use that portal to communicate directly with our team if you have any questions, but you'll be able to answer questions for your patients very easily about where they are in our process. And it's a really fun thing for me. I'm very excited that we got to launch this, and it's just going to get better and better. So keep that in mind. A little housekeeping before I get into the introductions, but if you do have questions, please post them in the chat. Karen and Phyllis are here to answer questions that you have. So add your questions into the chat. We'll make sure to get to them at the end. But now, Phyllis, first off, is the founder and president of Wearies, a provider of high-quality compression and post-surgical garments. Her earlier business career involved working with a large timber and wood products company Boise Cascade, followed by a 20-year term with Hewlett-Packard Corporation, both in Boise, Idaho. She had always wanted to establish her own company and find a way to use her skills as an entrepreneur. Going forward with her goal in mind, she established Wearies. Early products included a bra for women with limited mobility, followed by garments for post-surgical care. Today, Wearies provides quality, innovative products for both compression and post-surgical use, and she has always focused on providing quality, comfortable, innovative products with her end goal to improve the lives of others, and fits really well with what we do here. And our exciting guest here with Phyllis, that Phyllis was so kind to bring on board too, is Karen Ashforth. She is OTR, CLT-LANA. She's got alphabet soup after her name. She has practiced as an occupational therapist since 1981, specializing full-time in lymphedema and lipedema treatment for over 20 years. Karen is considered an international expert in treating complex lymphedema and lipedema cases, addressing underlying fibrosis and inflammation, and equipment innovation. Karen speaks frequently in academic, clinical, and professional settings and performs clinical research, which she publishes and presents nationally and internationally. So you've got this is going to be a treat for y'all today. Karen currently serves as an adjunct faculty at the University of the Pacific Doctoral Physical Therapy Program and has a telehealth consultation practice for both lymphedema and lipedema. So I had the pleasure of meeting with Karen last month, and just in a few minutes realized that she was going to be an amazing speaker for y'all. And I enjoyed our conversation. I realized that she's a thought leader in this industry. I really do think you're in for a treat. So without further ado, here's Karen.
Hello, everyone. Thank you so much, Josh, for the great introduction, and Phyllis for sponsoring this talk. And let's go ahead and get our slides up without further ado. So today's topic is going to be near and dear to my heart, which is fibrosis treatment. And a lot of people acknowledge lymphedema and fibrosis in the extremities, but I think that it's so important to recognize some of the special and unique characteristics of fibrosis when it is in the torso and abdomen area. So this is just a quick overview of the things we're going to cover today, just so that you kind of know that we'll be talking about fibrosis, but we're also going to be talking about some great solutions to treat fibrosis. And that's where Waries comes in. So stay tuned. Let's start by talking about the basics. We all know that lymphedema is excess interstitial fluid that creates swelling, and it is considered chronic lymphedema if the swelling is present for greater than 3 months. This is really important because when we stage lymphedema, we look at the amount of swelling, but we're also looking at the qualities of the swelling as well as the qualities of fibrosis. So this should be a review for everyone. What causes lymphedema to become irreversible? It's fibrosis. And all lymphedema patients, even those with stage 0, have fibrosis. So this is a very, very critical topic for anyone treating lymphedema. If you're not treating fibrosis, you are missing a big part of the treatment. What fibrosis does is it forms as a result of lymph stasis. So there is a reaction in the body where the high protein congestion fluid actually attracts fat cells, and through the process of lipogenesis forms abnormal tissue. This fibrotic tissue makes the body and the tissues in the area harder, denser, and stiffer. And what's really critical for lymphedema treatment is that it interferes with and blocks normal lymph flow. Fibrosis can be disfiguring. It very much can interfere with function. It makes lymphedema worse. And there is this vicious cycle where when fibrosis starts to develop, it increases swelling because it's blocking fluid flow. And so then that forms more fibrosis, which on and on and on. We're basically just ending up with more fibrosis, more swelling, more dysfunction. So it's very important to treat the source of lymphatic dysfunction. The obstruction begins in the areas of damage. So we want to look at scars, irradiated tissue, and those areas where lymph is just not flowing. There's some dermal backflow and lymphatic congestion. We have to deal with this fibrotic barricade. And there's a lot of different tools out there that can remodel hardened, damaged tissue. This is just a very quick, limited overview of some of the tools that you could be using in your clinic that we're not going to talk about today, but I want everyone to be aware that there are a lot of specialized manual therapy techniques, as well as many, many modalities, including positive and negative pressure, laser and light therapy, vibration, conventional ultrasound, low frequency ultrasound, extracorporeal shockwave therapy, as well as thermal modalities, dry needling, and our favorite silicone scar gel. Here today, we are going to talk about how we use compression garments for our patients. Why not make them anti-fibrotic so that you can treat the fibrosis as well as deal with the swelling? So what makes a garment anti-fibrotic? It's texture. So either the fabric itself is textured, or it can be a garment or a pad that is quilted with inserts of foam or other materials such as cherry pits. And when we pair the compression with the antifibrotic properties, it creates a micromassage effects to the tissues. What happens in the short term, so the first hour that the patient dons this compression garment, it starts helping promote decongestion. And then as they wear it more and more over time, it can start to soften that fibrotic tissue. But the first thing, the first rule of treating fibrosis is to decongest. So these garments do both. I like to say that they give the patient a massage every minute that you wear them. And we can increase the effects of these garments with exercise and external compression, such as pneumatic compression. This is just a little example of some of the lower body antifibrotic compression that Wearies has to offer. But before I go into the garments, I want to talk a little bit about lower body fibrosis. You can see in this woman with phlebolymphedema that she has a number of different types of fibrosis going on all at one time. She has lymphostatic fibrosis, which is the fibrosis that I described at first. It's the fibrosis that's made from lymph fluid. She also has the characteristic inverted champagne bottle lipodermatosclerosis, where she's got the tiny ankles and inflated calves because of the fibrosis around the ankles. She has a number of different types of dermal fibrosis, and this poor patient has had many bouts of cellulitis. So she has post-cellulitis fibrosis residual from her many infections. She's also experienced wounds, and so she has some residual wound bed fibrosis. Other types that thankfully she doesn't have, but are also seen commonly in the lower body, are post-thrombotic syndrome, massive localized lymphedema, surgical or traumatic scarring, or radiation-induced fibrosis. So what do we do? Wearies has some wonderful shorts that can be used with quilted chip foam compression inserts that can help patients deal with spot fibrosis in the abdomen, buttocks, thighs. Say someone has a node resection or a melanoma resection, or they have some type of abdominal surgery for cancer or orthopedic reasons. These inserts can be placed in all sorts of different areas and held in place with the shorts so that the patient is getting compression as well as the antifibrotic effects. Wearies also has some great capris. And I'm going to talk a little bit about what sets Wearies apart from other shorts and capris. Oftentimes we'll tell our patients to go online and find exercise gear. Sometimes there's medical grade compression from other companies, but I would say that Wearies has an edge when we're looking at lower body compression. Part of it is that there are so many features in terms of having a double layer of fabric, which aids in giving a little extra thickness. Because remember, our bandaging principles, more is more. So if we have a garment that's a little bit more robust, it's going to provide better compression. The seams are hidden, so there's no contact with the skin, which is wonderful for people who have skin sensitivities. It has UV protection to 50 plus. You can get these in short waist, long waist, plus sizes. And this is, I think, a well-kept secret that Wearies has the ability to calculate the amount of fabric in the front and back and crotch. So a lot of off-the-shelf garments they end up being too short in the front or too short in the back, depending on whether someone has more tissue in their abdomen or in their buttocks. And so Waries really has a wonderful system, even in their ready-made garments, to help them fit better and feel better. I want to point out that another thing that is so wonderful about Waries is that they have compression garments that are specific to men and fit men better. Because a lot of times we're sending men to just get different compression that isn't necessarily specific to the male anatomy. So let's talk a little bit about upper body compression for fibrosis. These are common types of upper body fibrosis. And so this particular patient has the first three. She's developed lymphostatic fibrosis as a result of chronic congestion. You can plainly see her surgical scar from her lumpectomy. And you can also see from the pigmentation that she has experienced radiation. And so she definitely has fibrosis as a result of that. Other types that we commonly see in our upper body patients can include cording, which commonly appears in the axilla, but can also go down the torso or down the arm. Patients who have had seroma as a complication of surgery can develop fibrosis. And I'm here to tell you that I've seen seroma fibrosis like golf balls. So it's so important to jump on this early and treat it right away so that it doesn't develop into this hard wad of tissue. Fat necrosis can occur as a result of different types of reconstruction if we're using patient's own fat tissues. And then also wound necrosis and postcellulitis fibrosis can also occur in the upper body. So what to do? Well, I have two compression shirts that I'd like to show you. This first one, the Andrea shirt, has an axilla pad that is already sewn in and is not going to migrate. And this is a wonderful garment that is very helpful for cording. It's helpful for drain scars because it goes down the torso. It is helpful also for lymph node dissection scars, and really helps to stimulate those affected lymph nodes. One thing about these t-shirts is they do not have pouches for prosthetics, but they do have the fibrotic treatment. This next t-shirt is unique because you can actually take out the fibrotic pad. So it's something that is really, really wonderful. I helped to beta test these pads, and they are fantastic. Again, no pocket for the prosthetic. So this is more about just kind of the all over compression of the thorax and the fibrotic focus treatment in the axilla. So when we're looking at other areas of fibrosis, notably in the chest area, Waries has paired with LNR to have swell spots that can be ordered through Wear Ease to use with their bras and their camisoles. And so these are three examples of a curved pad, a large coverage breast pad, and a circular pad, and how they can be used inside these Waries bras. We have some more examples here that can be used in camis, as well as, you can take any of these pads and insert them in a t-shirt too, because if the t-shirt is holding the pad in place, it's not going to necessarily migrate as much. Although it's with some patients who are very, very active, it's nice to be able to have those t-shirts with the sewn in pad or the pocket. This pad is amazing. My colleague, Leslie Keith, said that if she had one pad that she wanted to recommend, this would be it, because it can be useful in so many different areas. And this shows it used in that area between the cleavage that is very, very helpful in stimulating the peristernal lymph nodes. Now I'm going to switch gears a little bit because Phyllis and I developed this bra that is revolutionizing lymphedema treatment. And the story of how it came to be is that in my clinic, I had patients that wanted low profile compression. They didn't want to have the bulk of those chip foam pads, but they really needed a lot of anti-fibrotic action, particularly in the breast area, but also in the thorax and sometimes even in the back. So what I did was to take just a conventional post-surgical bra, and I cannibalized a garment that had the anti-fibrotic fabric and sewed it in as a lining, and my patient loved it. So I did that a lot. And I even brought an example to show at a conference, and Phyllis was at that conference and she saw that and her mind got going. She researched the fabric and she basically created this amazing garment that has anti-fibrotic treatment throughout the entire garment. It is wonderful, and patients absolutely love it because it is so comfortable. It covers a wide area. And one thing to know when you're ordering it is that it provides such good compression that it's going to feel really tight when the patient first puts it on. But if they have swelling, their swelling is going to go down and the bra is going to fit differently after they've worn it for a couple of hours. It's got a nice thick bottom margin, so there is no binding from that part if a patient is swollen, and it's very, very easy to put on and take off. So this is just another example of the bra in play, and you can see how it is stimulating all the scars in the breast, axilla, and thoracic area. And this truly provides relief from pain and swelling and promotes comfort and healing. So I'd like to tell you a little bit about what we did a year ago. We created a number of focus groups across the country, and we had a number of therapists and patients use this Carina bra. And here's what we found is that across the board, patients were reporting decreased pain, decreased swelling, decreased tissue hardness, and improved skin texture, as well as over time improved scar appearance and skin appearance. So we took this to the clinics, to the patient homes, so that we could actually make sure that this was going to be helpful. And boy, we sure found out it is. These are just a few before and after pictures of patients and how you can see visually it really made a huge difference. And this patient said it gives good compression and is effective in addressing the areas that are congested, the lateral trunk and right breast mostly, which was the area where she received radiation. Having the tool of anti-fibrosis along with compression is the perfect mix. It is amazing. I have had fibrosis that has worsened the last 3 years on the left breast. After a short time of wearing, symptoms are reducing. So this last slide is basically to give you an idea of what to expect from Wearies. And some of you have been using Wearies for years. Some of you may have never used Wearies before. So as a therapist that has used Wearies for over 10 years with numerous patients, I have to say that their products really have comfort, that their company gives great support, and that this really helps my patients in their recovery. So it's it's a wonderful company to work with. From a therapist perspective, they are always responsive. And what I love about them as an innovator is that Phyllis is really looking at the need for new products. And I can't really give you too many details today, but she is coming out with some new anti-fibrotic garments that are going to be amazing. And I am beta testing them currently with my patients. And we've gotten some wonderful, wonderful feedback. So check this website, the Wary's website, and Compression Care for new garments coming out, both upper body and lower body. So again, this is just a recap of why to do business with Wary's, and then their contact information. Phyllis is great. She's so wonderful to work with, and she understands therapists. She understands patients. So with that, I am hoping that there are some questions, because Phyllis is here to answer questions. I'm here to answer questions. And we're just so excited about being able to have compression that is specifically designed to treat fibrosis. So what do we got, Joshua, in terms of questions?
So yeah, first off, I was asked if they could be emailed, these slides. And I'll just say that, one, we will email you this entire presentation as a recording, but also we post these recordings on our website, so you can actually watch through the slides again that way as well. But I'm sure that we can get those out to you, so we can make that happen. And then another question here is, how do we measure for the pads?
Phyllis, I'm going to let you answer that one, because you know the measurements by heart.
For the pads, when you're using a swell spot, what I have found is you want to measure the body and make sure that it fits the measurements on our garment. And as long as it's going to fit within the measurements, and for the most part, Wary's garments run a little large, so we have a size chart. If your patient's measurements fall in between sizes, we always recommend sizing down. And what we found is you don't need a lot of extra room for the pad. It fits in between the body and the garment, and I haven't found where you want it all to fit snug and move together, and so I wouldn't allow a lot of extra room for the pad.
Yeah, that's what I've heard too. They've asked if these garments and the pads are covered by insurance, and I mean, as a biller, yes, absolutely. Now, there are some caveats there, like, does that plan cover it? But for the vast majority, absolutely, we can knock it out. So, also, what is the compression range on some of these garments?
Our garments are mild compression, so 15 to 20, mostly for the torso. You don't want to wear a lot of compression. You'll have difficulty breathing. So you want to be able to breathe. You want to feel comfortable, and you want to feel the garment snug. So you feel that immediate relief when you put the garment on. Women will frequently go, "Oh, I feel it." With the Carina bra, it's a little different. It's not so much about the compression as it is about the texture. But what we're learning from fitters is that you really want to fit it snug. So go by the measuring chart, and you might size up because it runs small. It is made on circular knitting machines, but back to, you want it to fit very snug, because what you'll see is your patient's measurements will decrease over time. It moves the fluid. And so what I've had fitters tell me is they'll have their patients or their clients fit the bra. They'll fit the bra snug, and then they'll tell them, even if it feels too snug, try to wear it a couple hours a day. and over time they'll see a reduction. So, and I've had that happen. I've had them call back and say, well, now the bra is too big. So,
Yeah. So, what is the benefit of the waffle weave material?
it provides that micro massage, which, like Karen was saying, improves circulation, and it works all day as you're moving. And if you're exercising and moving, it does even more. And that improved circulation helps move the lymph fluid, helps soften the skin. It does all the work for you. Right, Karen?
Absolutely. And, you know, just a word about how tight to make it, because there are some patients out there that really don't like tight garments. And I love this micro massage fabric for those patients, because what I found is, you know, we all have patients out there, and a lot of my lipedema patients also, they just don't want a lot of tightness and they won't wear tight garments. But with the micro massage weave, it compensates for not being as tight because it is stimulating the circulation. And so even patients taking breaths, just breathing is going to stimulate the micro massage action. So I think that it's a really amazing product, and I just love it for that reason.
Nice. So, sizing for larger patients. Can we accommodate larger patients in your standard sizings?
So we recently came out with a 2X, which is the largest in our range of sizes. Um, and it goes small, medium, large, extra large, 1X, and 2X. Now, sometimes women are beyond that range, but we have another bra, the 790, which comes in sizes up to 4X, which fits a 64-inch bust. And with that bra, it gives you really good support, really good compression. But if you want the texture, or you're dealing with you want anti-fibrotic, then that's where you want to use the SP09, the LNR swell spot, which comes in small, medium, large. So I would say the 2X is as big as we can go with our current technology. But we do have the other bra, which runs very large.
Okay. What about custom made garments?
Currently, we're doing very little custom made products. What we've tried to do is if there's a need for a product and we get that feedback, or continually ask for something, then we'll add it to our product line. So we'll develop it and add it as a off the shelf.
Okay. And I think this is kind of a good one. How does would a therapist measure for the Carina?
So measure, preferably with a bra on. You want to measure the fullest part of the chest or the nipple line with a bra on. And if they're going to be wearing a prosthetic with the bra, you want to include that in the measurement. So it's in inches. Our size chart's in inches. And then you measure and then you look down, look at the dimensions on this chart.
Awesome. Okay.
And I would add that a lot of women like to wear the Carina bra at nighttime because they want to have that compression and antifibrotic action 24/7. So oftentimes women will choose to have it fit a little bit looser at nighttime. And sometimes we'll do with the Carina, like I do with other compression garments, is that if one is starting to get a little bit worn and stretched out, because this is an elastic material and this is going to stretch over time, so they will need to be replaced. But you can always use the looser garment that has been worn for a while at nighttime. And what's really great about this fabric is that it does not lose its anti-fibrotic properties with washing. I personally have anti-fibrotic garments that I use when I do air travel, and I've had them for over 12 years, and they have just stayed intact through many washings, many wearings. Obviously, since I'm just wearing them for air travel, I'm not wearing them every day. But boy, I've flown a lot in the last 12 years, and the garment just keeps its action. It's wonderful.
And one other thing about sizing too on the Karina bra, it comes with pockets and bust cups inside the pockets. But if you take those bust cups out, the garment can be very flat. So it works like a vest, and you can use it for women who are flat chested. It works for that body type too.
I'm glad you brought that up, Phyllis, because a lot of therapists have asked me about using the Karina right after a mastectomy surgery. And my feeling is that anti-fibrotic fabric is very appropriate for post-surgical patients, but you want to wait a little bit for the skin to heal. And sometimes it can be irritating if you use it right away. So I would wait, at least a couple weeks, maybe 3 weeks, because fibrosis doesn't actually start forming. We don't form scars until 3 weeks after a wound. So I would say that just using a compression binder as the patient reduces post-surgical swelling, and then you could fit for the Karina bra after that.
Okay. Now I heard you mention something, and I just want to confirm it. So the Karina can be worn at night as well.
Absolutely.
Okay.
Yeah,
Awesome.
so we are currently working on a PDAC code, and that code is for a nighttime bra.
Oh, nice. That's awesome. I love that. So, what about the actual fabric? What is the fabric? What's the content of the fabric?
It's 93% nylon, 7% spandex.
Okay.
But what makes it different from some nylon products is the weave. So it's very, very soft.
And it's very breathable. I really don't like wearing synthetic fabrics, but I find that this fabric is very skin friendly and is very comfortable to wear.
Awesome. Now, I know personally that I do have a shirt that Phyllis was nice enough to get to me, and I like working out while I wear the shirt, and so I do appreciate it. So it's not the Karina bra, but just
But it could be.
my personal experience with it. I enjoy the heck out of the shirt. So let me see. Any other questions? Anybody have any other questions, please put them in there. Otherwise, I'm going to start wrapping it up and letting everybody move about their day. But, I'd like to thank you all for attending the series. We appreciate the questions. We appreciate the attendance. I hope that you're all as excited as we are. You can find more information about us. Again, you can sign up for the next educational series. That's all on our website at compressioncare.com. There's actually a little banner that'll pop up across the top. And if you click that, it'll go directly into our educational series. And you can see the past videos, including this video, will be posted on there as soon as we can get that up there, hopefully just a day or so. And then I'll see about getting some slides out to you as well. That is it. Thank you so much. I appreciate Phyllis. Thank you so much for coming on here and for introducing me to Karen. I really do appreciate that. And Karen, thank you so much for doing that presentation and talking about everything we needed to hear. So thanks so much.
Well, thanks for the opportunity, Joshua. And if anyone has any questions, you can call me.
Absolutely. That same thing. Me. Shoot me. I'm getting a lot of thank yous here. I appreciate it too, but you're welcome to shoot me an email if you do want to be connected and you don't have Phyllis's contact or Karen's contact. Please shoot me an email. It's easy. It's joshua@compressioncare.com, and we'll knock it out so much. So thank you all. I appreciate you. I know I'm getting a lot of thank yous. So you're getting a lot of thank yous, Phyllis and Karen. I know you can't say all the chat, but you are. So I definitely appreciate you here. And if y'all need anything from us, just holler.
Thank you.
We'll see y'all later. Bye-bye.